Hello, my name is Susan Ryan, and I'm the director of the Center on Disability and Community Inclusion at the University of Vermont. I'm very happy to be your presenter this morning on the topic of fetal alcohol spectrum disorders, the basics. Let me tell you a little bit about my background. I am 37 years in the field of special education. I was a special ed teacher for 12 years myself, working with children with a variety of different disabilities, and 25 years I spent it in Alaska. 15 of those years I ran a graduate program in the area of early intervention to prepare people to work with very young children that had disabilities. But for 6 years I worked with the Office of Fetal Alcohol Spectrum Disorder in Alaska. So it's within that context that I am presenting to you this morning. I have with me today Jill Stevens, and I'd like her to introduce herself to you at this time.
Good morning. I'm Jill Stevens, and I am the adoptive parent of a 23-year-old young man with FASD, and have lived a life of making discoveries about mental illness and FASD. I'm a speech and language pathologist in the Burlington schools, and I'm very happy to be here today.
Okay, wonderful. Thank you, Jill. There are three main reasons why we're presenting this information to you today. The first is that we want to increase awareness of FASD in the state of Vermont. The second is that we want to bring attention to the needs of children who have FASD and their families. And third, we want to stress the importance of prevention, a need for a prevention campaign in Vermont, and intervention and support individuals with FASD and support to their families. So thank you very much for signing on. One of the first things we're going to do is to present you with a survey or a poll. I'd like to know a little bit about who's online, and so it will be up on your screen in a few minutes. I need to adjust the microphone. Okay, so you should see the survey on your screen, and if you could just please indicate who you are. And I can see on the screen that people are able to indicate who they are, and then the numbers are coming in. And 50% of you have voted, and we'll give you a couple more minutes. We're almost at 100%. Okay. Well, at this point, we can see online that about 33, more people are indicating. Thank you very much. We're almost to 100%. Okay, so we have 50% of people online are educators or an administrator. About 30% of you online are social workers or case managers. We have 21% that are parents of children with a disability. So great, welcome, thank you very much. And we have one more poll, and the person assisting me today is going to put that right up. I want to know a little bit about your experience with fetal alcohol spectrum disorder. So you'll be able to indicate whether or not you're a parent or an adopted parent of a child with FASD. Are you currently or have you ever in the past worked with any students or children or youth with FASD, or indicate whether or not you have no experience with FASD. And again, you're responding, and we can see them coming up online here. I'll give it about 30 more seconds as you're finishing the poll here. Okay, most people have responded, and it seems as if about 40% of you have no experience with FASD, about 60% you have worked or worked with anybody who has FASD. Okay, and I think one last survey question to start the day with. I wanted to ask you, is FASD a diagnosis? Yes, no, or I really don't know. You should see the poll on your screen if you can. Okay, very good. So 100% of people, oops, somebody's changing. We're still going. And you're still voting. Okay. So about 85% of you think that it is a diagnosis, and about 14 or 15% really don't know. Thank you so very much for responding to these three polls, so that we get a sense of who's online and some of the other things. So we're going to move to the presentation now, and I wanted to give you a brief overview of what I hope to share with you this morning. And this presentation is broken down into 5 different sections. The first would be understanding fetal alcohol syndrome, individuals with FASD, what their strengths, their difficulties, and approaches might be. Third, prevention and risk reduction. Fourth, resources. And 5, conclusion. If we do not finish all of it, then we'll have a second webinar to cover the rest of it. This material is presented by the Center on Disease Control, the Substance Abuse and Mental Health Services Administration through the Department of Health and Human Services. So in this particular section, we're going to talk about FASD, which is Fetal Alcohol Spectrum Disorders, and from now on in the presentation, I'll just use the acronym as FASD. Some diagnostic terminology, facts about FASD, facts about alcohol use among pregnant women, causes of FASD, what a standard drink might be and why that might be important, and the economic costs of FAS. So FASD is an umbrella term used to describe a range of conditions that occur in a mother who drinks during pregnancy. So again, it's an umbrella term. Many may also include physical, mental, behavioral, or learning disabilities with possible, or more often than likely, lifelong implications. So Canada uses the single term fetal alcohol spectrum disorder, and the United States uses the plural disorders. But both of them are descriptive terms and they're not a diagnosis. So the definition of FASD was agreed upon in April of 2004 by a group of national experts representing the Center on Disease Control and Prevention, which is the CDC, the National Institute on Alcohol Abuse and Alcoholism, which is NIAAA, the Substance Abuse and Mental Health Services Administration, which is SAMHSA, Health Canada, and the fields of research, psychiatry, and justice. The meeting was facilitated by the National Organization on Fetal Alcohol Syndrome, or NOFAS. So all of these groups will be referenced in the PowerPoint PDF that you will get upon completion of this webinar. But the important message here is that FASD is the umbrella term. It's a descriptive term, and it's not a diagnostic. And, but the definition of FASD was put forward by this group in 2004. So the diagnostic terminology is really fetal alcohol syndrome, so that's the diagnosis. And the term was first used in 1973 by 2 physicians, Ken Jones and David Smith, both from the University of Washington. And while FASD describes a range of disorders, FAS is a specific defect caused by alcohol use while pregnant. Again, FAS is the diagnosis, and in fact it's a medical diagnosis in the International Classification of Disease, or the ICI. So although FAS was first talked about in the United States in 1973, it was also being discovered in France in 1968 by a physician named Lemoyne in France. And he had a number of individuals in his practice that were showing similar facial dysmorphology and some similar behavioral characteristics. And he is actually the person that's attributed to recognizing this as an actual syndrome, and that was in about 1968. And in the United States, Dr. Ken Jones and David Smith are the ones that have done a lot of the early work on FAS. So other diagnostic terminology that's used to refer to the effects of alcohol on the developing fetus are, and that you might see in the literature, is alcohol-related neurodevelopmental disorders, or ARND, partial FAS, fetal alcohol effects, alcohol-related birth defects, or ARBD, and static encephalopathy, which is an unchanging injury to the brain. So in some regards, there's no real consensus in the United States on the terminology used to describe the effects of prenatal alcohol exposure other than FAS, fetal alcohol syndrome. And some physicians, some people will use the FAS, and some will use FAE, fetal alcohol effects. Others use alcohol-related neurological disorders, ARND, and still others will use alcohol-related birth defects. And so I have another poll for you at this point. I wanted to get a sense of those online. What's your understanding? Is FASD more common or less common than autism? So the question is FASD more common than autism?
Okay, type the answer in the question box.
Oh, at this point, I guess you'll have to type the answer in the question box. You just write yes, no, or I don't know. Oh, I see. Okay. And it's coming up on a different screen here. We see a variety of people are answering yes, no, or I don't know. Thank you very much. Okay. Okay, I see a couple of you are still finishing. It's not tallying the results, but I can see that we have people, a third saying yes, a third saying no, and some saying I don't know. So here are some facts about FASD. So FASDs are the leading known cause of preventable intellectual disabilities, which we previously referred to as mental retardation. FASDs affect an estimate of 40,000 newborns every year in the United States, and that number has it's changed, and I'll talk about a little bit about the changes in the figures later on. FASDs are more common than autism. In fact, the Autism Society of America estimates that there are about 24,000 new cases of autism each year. And then both of these figures are changing as far as the statistics on FASD or ASD. The effects of FASDs are lasting a lifetime. That's one of the take-home messages from today is that FASD is a lifelong disability with lifelong implications. People with FASD can grow, improve, function well in life with proper supports. Another take-home message for today is FASD is 100% preventable. We have another poll for you. Oh, and we're not able to do that at this time. So I would just want you to consider about what amount of alcohol is safe to drink when pregnant. So is it any amount, 1 drink a week, a drink a day, a drink a month? We don't know what amount of alcohol is safe, or no amount of alcohol is safe. So I want you to consider that as we go forward with some of these slides. So as I said, this presentation is put together from materials from Substance Abuse and Mental Health Services Administration and the Center for Disease Control. I was involved in the CDC project in Alaska for about 6 years, and currently I'm involved with the Southeast Center on Excellence in FASD, and been involved in providing support and training in both of those states and areas. And the CDC comes out with that there is no amount of alcohol consumption during pregnancy that is proven to be safe. In fact, the Surgeon General's advisory on alcohol use in pregnancy in 2005 put forth this statement. So FASDs are not caused by the biological father's alcohol use. They are not caused intentionally by mothers. Many women simply may not know when they are first pregnant or may not be aware of the harm that alcohol consumption has during pregnancy. So at the end of this presentation, you'll have a document that was put together by the Vermont Department of Health, Alcohol and Pregnancy Vermont Statistics. And on the document, you'll see that 65% of women of childbearing age in Vermont are current drinkers, that they drank alcohol in the last 30 days. And of these, about 23% are binge drinkers, and binge drinking being defined as 4 or more drinks in a sitting. Another alarming statistic related to alcohol use by women in Vermont is that 72% of Vermont mothers report drinking at least some alcohol in the 3 months prior to pregnancy, and nearly 1/3 report at least one binge drinking, 4 drinks or more, episode during their pregnancy. So these are very important statistics and have a lot of implications for Vermont in the way we might think about a prevention campaign, in the way that we might think about support to mothers by physicians and by support of the consequences of alcohol use during pregnancies. So I'll also interject at this point that September 9th is FAS Awareness Day, and the state of Vermont is going to be launching a prevention campaign at that time. And you can Google that. It's 049, and that's literally the numbers 0, 4, and 9. And what that stands for is zero alcohol for the 9 months of pregnancy. So the second point on this slide says that it's not caused by the biological father's alcohol use, but what is really important, one of the things that we stressed in the state of Alaska, is that the biological father and other people who support the mother can support the mother's abstinence from alcohol, obvious, during the 9 months. So there is a role for the father. Here are some facts about alcohol use among pregnant women. Nearly 12% of pregnant women report using alcohol in the last month, and these are facts for the general United States, and I just read the other facts related to Vermont. So in the past month, alcohol use among pregnant women and recent mothers aged 15 to 44 did not change significantly between 2002 and 2003, and then again when the data was gathered in 2006 to 2007. Nearly 16% of pregnant women use alcohol in the past month, and they consumed an average of 24 drinks in the month. They drank on an average of 6 days during the past month and had an average of about 4 drinks on the days that they drank. And this is important information because, as this presentation will show, we really don't know what level of alcohol impacts the fetus and at what point during pregnancy. So again, the message coming out of the Center for Disease Control and the work that was done in Alaska is that no amount is safe. So these statistics, both at the national scene and in Vermont, are ones to take and pay attention to. I'm not sure if we're going to be able to do this poll. Okay, I'm being told no, but question, I can check. So the question is, what teratogen has the greatest impact on the developing fetus? So while we see whether or not we can launch this poll, we cannot. Okay. Please, we'll learn how. Okay. So the question is what teratogen has the greatest impact on the developing fetus? Would that be cocaine, heroin, alcohol, or marijuana? Be really interested to know what the listeners would be able to say about that. But you might be surprised to see that the answer to that, as we advance the next slide, So the sole cause of FASD is a fetus being exposed to alcohol, and alcohol is a teratogen, as we all know, as well as other substances, including cocaine, heroin, meth. But it's alcohol of all those substances that produce by far the most serious neurobehavioral effects on the fetus, and that is, we've known that since 1996. And that is from a report on the Institute on Medicine that was reported to Congress. So other teratogens that the fetus is exposed to that you might be aware of are lead, certain medications, other toxins, and other of these substances that we named. But of all of them, alcohol has the most effect on the developing fetus. I know when I first heard that, I was quite shocked by that most people think it's cocaine or heroin, and that's not the case. So all alcohol beverages are harmful. Some researchers have found that binge drinking is especially harmful. I did a Fulbright in Ireland in 2004, 2005, and I'm an Irish citizen, so I'm not picking on the Irish race here at this time, but they have a high rate of binge drinking, and some of their research was showing what a significant impact that binge drinking had on the developing fetus. So, but at the same time, physicians had been telling women in Ireland that Guinness contained iron, and that it would be good for them and for their baby. So Ireland is becoming much more aware of the impact of alcohol on the developing fetus, and they're have a good prevention campaign as well as some research and intervention that's being done. But going back to the slide, so another take-home message is that all alcohol beverages are harmful, and that binge drinking is perceived by some as extremely harmful. And while it's true that not every woman who drinks during pregnancy will have a child with FASD, that does not mean that the disorders are rare or random. Anytime a pregnant woman consumes alcohol, it becomes possible that her baby will have FASD. And as I said, I worked in Alaska for 25 years, and their Office of FASD is has come up with a very strong statement about no alcohol use is safe during pregnancy. So CDC has put together this slide, and it talks about like what is a standard drink, and they present that information because it's interesting that a lot of people don't. When asked about the amount of liquor or alcohol that they consume, researchers have actually found that they have underestimated the size of their drink. So you can see on this slide that 12 ounces of beer or a cooler is considered a standard drink, while 5 ounces of table wine is considered a standard drink. And even at restaurants in Burlington or elsewhere around the world, you might get more like 7 ounces in a glass of wine. So this is important, because it can tell you about what's considered a standard drink. In recent research, frequent drinkers and the majority of women report that they're drinking larger than standard drinks. And daily drinkers were consuming drinks that were anywhere from 3 to 6 times the size of a standard drink. And the majority of drinkers underestimate, as I said, the number of fluid ounces that they are consuming. So another issue that we wanted to talk about is the economic costs of FAS. And so if one did not think it was important to address the needs of prevention of FAS or FASD, or the needs to provide supports to families who have a child with FASD, or interventions for increasing lifelong outcomes or educational outcomes, if the importance of that didn't impact you, perhaps the economic cost of FAS would. FAS alone is estimated to cost the United States nearly $4 billion each year. And this information, again, is put together by CDC. The average lifelong cost for each child with FAS is almost $3 million. And so Differences in cost estimates relate to various factors, including elements used to calculate the costs, but the costs include medical treatment, residential care for those up to 21 years or even older, all residential care or just care for individuals who have intellectual disabilities, residential care for people other than having developmental disabilities or intellectual disabilities, the cost of special education, the cost of loss of productivity, and so all those are costs that affect. Here's another slide that you can see. So one preventable case of FASD would save $130,000 in the first 5 years, $360,000 in 10 years, $500,000 in 15 years, and more than $1 million in the 30 years. So there's an economic cost of alcohol use and of FASD to society or to education or to the medical or the criminal justice system. So these are some statistics that would speak for the need for a prevention campaign in Vermont and across our state. So the second section of our presentation we're going to move into now, and this is going to talk a little bit more about individuals with FASD, their strengths, their difficulties, and some approaches that might be effective for working with people who have FASD. I'm not sure if we can do this poll. Very good, thank you.
We can do the other ones too if you want to go back and do that.
So the question that you'll see on your screen is, do you know a child, youth, or an adult who has any of these characteristics, has difficulty attending to task, has poor memory, has poor judgment, decision-making skills, time management skills, performs poorly in school, or mother who drank while pregnant? So I see that that's a yes or no. So I see that that many of you online know children who have some of these characteristics. As we advance the slide, you'll see that these characteristics are ones that you would find in an individual who has FAS or FASD, but you would also know, those of you online who are parents or educators or other case managers, would know that those characteristics also are ones of individuals who have other disabilities beyond FAS. So here are primary disabilities that can occur in people who have FASD. So many of the individuals have lower IQs. They have impairments or challenges with reading and literacy, spelling and arithmetic. And some of those are not picked up, obviously, until the individual might be somewhere between 2nd and 4th grade. And some individuals with FASD have lower levels of adaptive functioning. So the primary disabilities are characteristics or behaviors that reflect differences in brain structure and function, such as intellectual disability, attention deficits, or sensory integration dysfunction. But the secondary disabilities that people with FASD have can include behavior challenges with academics or adaptive behavior skills. So many individuals with FASD have challenges in adaptive functioning. And just by way of reminder for folks online, those would be challenges in areas such as self-care, activities of daily living, social interpersonal skills, use of being able to use community resources, being able to be self-directive, academic skills, ability to work or have employment, leisure skills, health, and safety. So, so those are challenges that affect individuals with FASD. Going back to IQ just for a minute, Ann Streifers, who many of us consider to be like the grandmother of FAS, she did some of the seminal work in the area of FAS and FASD between the 68 and 90. And much of her research has shown that about the average age of individuals with FASD, the average IQ of individuals with FASD is 79. People with FAE, as we mentioned, or fetal alcohol effects, or FASD, have an average IQ of about 90. And as we know, an average IQ is about 100. So here are some typical strengths of people with FASD. So we talk a lot about their challenges or their deficit, but many of them are very friendly, very cheerful, very likable, they're desire to be liked, very determined, have incredible points of interest, very helpful, very verbal. Every day is a brand new day. I worked with a number of young children with FASD in Alaska, and there was a young boy I met when he was in 6th grade, and he was a very accomplished dog musher. He and his father mushed dogs, and he was able to take care of the dogs. He dog mushed throughout the tundra for hundreds of miles, and he was an accomplished salmon fisherman, and he hunted with his father for caribou and geese. So many of them have a lot of expertise, you know, some that shines outside of an academic or the school walls. So it's important to, as we talk about the individual's deficit, just as in every disability, it's important to focus on what their capabilities are, and again, the positive their nature, their social interests, and their ability to meet each day with excitement and a positive energy. Some of the other challenges that you might see with people with FASD is they have sensory issues, and that might be exhibited with their inability to handle different textures, their certain clothing, food, loud noises. Some of them might be have motor issues, but again, many of them have a lot of strengths in that area that I've seen in my work. Some people with FASD have information processing. They have difficulty completing a task, difficulty doing chores, difficulty problem determining what to do in a given situation. Do not ask questions because they want to fit in. They have trouble with changes in tasks and in culture. People with FASD might appear to be oppositional, and they might appear that way because they don't really understand what the demands are being placed on them. So one of the major characteristics that people talk about with FASD is the impact of alcohol on the area of the brain that involves executive functioning, the ability to make decisions, to be able to problem solve, to be able to process information. So you will see a child or a young adult having difficulty with following multiple directions, saying that they understand things when they really don't, having verbal expressive skills that often exceed their verbal receptive abilities. So these kids or these young adults might be very verbal and be able to express themselves, but might not have be able to understand the information that is coming in, be able to organize it and process it. They misinterpret people's words, actions, or body movements, oftentimes because they're very literal. So those are all real. This is really important information to understand about an individual with FASD, because sometimes parents or educators might perceive it as opposition or oppositional defiance, and where it really is an inability to process information as a result of the impact of the alcohol in the brain, and specifically of the impact of the alcohol in the executive functioning area of the brain. So these are all really important things to remember when you're thinking about intervention, whether it's in school as a special education teacher or a regular education teacher, or a parent. So a little bit more on the concept of executive function and decision making. So many of these children, you'll see that repeatedly break the rules. They get into peer pressure. They tend not to learn from mistakes or natural consequences. I've worked with teachers in Alaska that talked about, well, I give them a direction, you know, first thing in the morning, and within a couple of hours they don't remember or they're not following it. So the need for repetition, if you wanted to jot down interventions that are effective with individuals who have FASD, repetition is a necessary intervention. They frequently don't respond to reward systems that educators or parents might put in place. But sometimes these individuals don't respond to interventions because they aren't done consistently. You know, somebody might try something for a day, and if it's not working, they might switch to a different strategy. And so being consistent with people with FASD is very important. Some parents and educators report that individuals with FASD have a really difficult time entertaining themselves. They need to be directed by their parents or the educators. They might be very naive and gullible, and they might walk off with a stranger. So I'm going to stop here and stress a couple of other things. The challenges with executive functioning and decision making put our young children, our young adults, or adults at high risk for being taken advantage of, and it puts them at high risk for being used by other people to do things that if they were able to problem solve and use executive functioning, they would be able to stay away from. They don't often learn by their mistakes. So here are some other difficulties that people with FASD face. Some self-esteem and some personal issues. So you see some children functioning unevenly in school. So they might do really well on one day, or really well in particular areas of a given subject. Like for instance, in literacy and reading, we have found that children with FASD can learn to read, but their reading comprehension doesn't always follow their reading ability. So they might have scattered skills. And they might function unevenly both in school and work in general. And people might perceive that as I mentioned before, oppositional, and it's often the case that it's more than a challenge with executive functioning and also some personal self-esteem issues. Some are considered lazy or uncooperative or unmotivated, and have often been told that they're not trying hard enough. And this is really detrimental to a person's self-esteem or personal issues, as you can well imagine. So this is really important. Another important take-home information is that they're not lazy or uncooperative. It's just the ability, their executive functioning, and their ability to problem solve and to make decisions and to follow through on directions. And that educator or parent's misunderstanding of that could contribute to a poor self-esteem. Or conversely, understanding that can really help the parent or the educators be able to reframe how they are giving directions and reframe their approach with people with FAS or FASD. Some individuals have hygiene problems, and as I mentioned before, with challenges with the activities of daily living. Many of them are aware that they are different. And as one of the previous slides said, that the average IQ of an individual with FAS or FASD is 79. So you can see with that IQ that they have an awareness of their disability. I was with somebody, again, in Alaska in a rural village, and he had been diagnosed, and somebody was actually name-calling. So this falls into the bullying category. People are calling him FAS. And so you can imagine with a label like that, or what that would do to somebody's self-esteem. Oftentimes, individuals with FAS or FASD grow up living in multiple homes and experience multiple losses. So here are some risks of not accurately identifying and treating an FAS. So here are the risks for individuals who have FAS: unemployment, loss of family, homelessness, jail, premature death, increased substance abuse. So we see sometimes individuals who have been exposed to alcohol during pregnancy and are FAS or FASD succumbing to those substances as they become even in junior high school or high school as adult. In other words, that they become drinking, that they get the wrong treatment or intervention. So these are some risks that individuals with FASD face. Some of the risks to the family, the loss of family, increased substance abuse on the part of the family, premature death of the birth mother, financial strains of the birth families or the adopted or foster families, and emotional stress. So I'll stop here and share with you some troubling statistics that have been available to the field. And when I say the field, I mean the medical field, the physicians, the educators, and parent organizations. This information has been out there since 1996. Again, Ann Strijsgoos did a 4-year CDC study that was funded by the CDC, and that was out of the University of Washington. You can find her work online, and the University of Washington does some of the major work in the area of FASD. They have a center that does clinical diagnosis. They have been doing research since the 70s, really. So the CDC sponsored this study, and it was a 4-year study that examined 415 individuals with FAS and FAE who had been through the university's clinic. They ranged in age from 6 to 51. In addition to having the primary diagnosis of FAS or FAE, a significant portion of these individuals experienced secondary disabilities. There might be many reasons for these disabilities, including environment and other individual processes information. This was only one study, and it didn't have a control group, so you can take the information with that in mind, any of you that are researchers and that understand the importance of having a control group. But given that, there's still some numbers that are important to pay attention to. 94% of the individuals with FASD had mental health issues. 43% of them had disruptions in school experiences. That means that they were in and out of schools, and because either in and out of foster care placements or in and out of different treatment centers. 60% of those aged 12 and older had trouble with the law. So some of that encounters with the law could happen as early as 6th grade. The young boy that I was involved with started running away from home at 6th grade, started experimenting with marijuana in 7th grade, siphoned gas from a boat and burnt down a shed, in about 8th grade. And so 60% of them had trouble with the law. 50% experienced confinement in jail or treatment facilities in one kind or another. You'll see individuals maybe being placed in residential treatment centers, short-term or long-term. You'll see them sometimes going in and out of jail for low-level crimes, and then depending on, again, going back to that concept of them being able to be taken advantage of easily by others, that number increases if they get involved in any kind of drug or alcohol use. 45% engage in inappropriate sexual behavior. 23% of the adolescents, 40% of the adults, and 35% overall have alcohol or drug problems themselves. 83% of adults experience dependent living, and about 80% of the adults have employment problems. In other words, that aren't able to keep or maintain a job. So these statistics are really troubling, and ones that the country and Vermont need to take seriously. So here are some factors that contribute to reducing those lifelong complications. So what Strijsgoos and her colleagues found was another take-home message for today, is that what can we do about this? Well, first we can have a strong prevention campaign. And that's one that Vermont will be looking at hopefully in the coming years, and definitely on September 9th when they launch the 049. So a prevention campaign. Another thing that Ann Strydsky found out that a stable home was really important. And if there was one person that was in the individual's life for their entire life, that the outcomes were more positive. They found that an early diagnosis was important. So, and an early correct diagnosis. Many of the individuals that I have worked with, they received an early diagnosis, but it was attention deficit hyperactivity disorder. Some of these kids appear in school with the labels of emotional disturbance. Outside of school, they might have a label as oppositional defiance, behavioral disorder. So it's important to have an early diagnosis of FAS or FASD, and I say that only with as an educator, special educator myself, diagnosis is only important if it is then linked to intervention or supports or treatment. I say that for the child themselves as well as for the family. So when we look at this slide and you say a second thing is early diagnosis, my addition to that would be early diagnosis followed by interventions. You know, what are interventions that would help people be more successful in school and outside of schools, and what interventions or supports are needed for the biological family, for the adopted family, or for the foster family. And that's where parent organizations like BFN could play a really strong and leading role in that regard, providing the support to families. And that's where school systems, both special education for those individuals that are qualified for special ed, and regular education. Some people do not qualify for special education, but can also provide support. Other factors that contributed to a more successful outcome was a good quality home from the early years, from 8 to 12, and basic needs being met for at least 18% of their life. I'm trying to advance the slide, and I'm looking at the time. We have probably time for just a couple more slides, and then I was going to open it up for questions. And I understand that BFN will be collecting the questions, and I'll be able to take a look at it. So just only trained professionals can diagnose FASD, and these are usually the group of people that come together on a diagnostic team as a geneticist, developmental pediatricians, neurologists, dysmorphologists, educational consultants can sometimes diagnose this, psychologists, psychiatrists, and other people that can assist with the diagnosis are OT or speech and language pathologists. So I'm going to end the formal presentation with just a slide here on some resources for you, and then we'll open it up for questions. So this is a really good resource for you. The Center for Disease Control have FASD centers across the United States. There are 5 of them. New England does not have an FASD center, but as I said, some of us are involved with the Southeast FASD Center. So if you wanted to Google this, it's at fasdcenter.samhsa.gov. And the other support that is available to you, both as parents and as educators or practitioners, is NOFAS. It's a great organization, a national organization on fetal alcohol syndrome. And just in general, the Center for Disease Control and Prevention is a great resource. Okay, so we have a couple of questions here, and then I'm also going to give Jill Stevens, adopted mother of a young adult with FASD, a couple of minutes to talk to you. So do you feel that medical practitioners in Vermont are adequately counseling their pregnant patients in safe practices on the risk of FASD? I would answer that by saying I think that Vermont has a long way to go in terms of awareness of FASD, and I think that there is a growing interest in addressing that, and we can even see that by this publication that the Vermont Department of Health has just put out. And Patty Baruti at ADAP is a FASD coordinator for the state, and she is fully aware of these issues and working with a number of people to increase the awareness of FASD on all areas, to the general public, to the medical profession, to the educators, to family support networks and those kinds of things. So let's see. So how does Vermont compare with other states in terms of birth rates and FAS? Vermont isn't collecting any specific data because on FAS or FASD, but if you look at you will have a handout with these PowerPoints that again is Vermont's, published from the Vermont Department of Health. It's labeled Alcohol and Pregnancy Statistics, and we're bringing that up right now. You can see that Vermont women, 65% of childbearing age in Vermont are current drinkers. And if you scroll down a little bit more, 72% of Vermont mothers report drinking at least some alcohol in the 3 months prior to pregnancy. And nearly 1/3 of the Vermont mothers report at least one binge drinking episode. So that is from the 2010 Vermont PRAMS data. So this would make one think that we have people that are at risk for giving birth to a child with FAS or FASD. So we might pay attention to that data and again move towards doing prevention campaigns, working with physicians to be able to screen or diagnose that, or working with individuals like one of these questions imply, so that physicians are counseling people to abstain from alcohol consumption during pregnancy. So I'm going to just give the mic to Jill Stevens for a minute, and maybe she has some things to share with you from being an adopted mother.
Thank you, Susan. I have had the advantage, if you can call it that, of having my son's whole life to learn about this condition. However, a lot of his behaviors have been attributed to other conditions such as ADHD, reactive attachment disorder, bipolar disorder, borderline personality disorder, and as a result of that, the primary situation was not addressed. We've certainly addressed just about everything and tried many programs, schools, summer camps, physicians, counselors, and in the end nothing really worked, and it seemed to be getting worse and worse. And it took a long time before we really understood what the alcohol consumption of his biomom had done. So I would say that it's really important if you drank while you were pregnant, or if you know that the biomom of your adopted child drank while pregnant, the odds are that the primary disability is fetal alcohol, and to begin to address that sort of thing and to understand that there really are just some things that a child is not able to do or to understand. My son, for his whole life, has had the characteristics of many of the other conditions such as ADHD and bipolar, but he also had things like being overly friendly to strangers when he was quite young, and that was always something that my husband and I had to be aware of as a potential danger. And as he got older, he became very much a follower and has subsequently gotten into trouble with the law and has been in court many times, has spent weekends in the juvenile detention center or in jail, which are the exact places where he shouldn't be, but nobody knew. And that is because he doesn't really understand consequences. He doesn't seem to have a capacity for understanding cause and effect. And another thing is that he has shown is rage and really unquenchable anger at times. And I'm beginning to understand that he is not necessarily able to express what his problem is at the time, or he has misinterpreted something, which he does quite often. But that has erupted into these horrible, angry situations in our household, not to the point of physical violence, but that has certainly been a threat, and we've been very frightened of his behaviors, not understanding that he's reacting out of frustration and an inability to really regulate his emotional responses. That doesn't make it any easier, but now that we can understand that, we don't have to have police cars in our driveway and people searching him out in the middle of the night. There are so many stories that have come out of his having fetal alcohol spectrum disorder. And so I'll just end by saying that it's so important to be aware, and if you have a suspicion, to seek help from a physician or another practitioner who can diagnose and lead you in a direction where there can be some intervention. And I would say that that is primary.
Thank you, Jill. It's I just met Jill a short time ago, and she was very gracious to join this webinar with me, and I really appreciate your involvement. One of the things, are there any other questions? The BFN host is suggesting that we take a couple more questions. And while we kind of process that, I want to stress there, I have at least 4 take-home messages for you. And one is that this is a lifelong disability, fetal alcohol syndrome, fetal alcohol spectrum disorder. So we recognize now that individuals who have FASD will need supports for their entire life. As Jill is giving an example, her son is 23 years old. Another one is that it is a disability in and of itself, FAS or FASD. I have had people say, FAS, well, isn't that really ADHD? So, and I would suggest that we would never say that about autism spectrum disorder or any other disability. So there is a disability called FAS, and there's a disorder called fetal alcohol spectrum disorder. And we need as a state, Vermont, to recognize that. And we need to recognize a third take-home message is that families, as Jill just voiced to all, need intervention and supports. So, and they need lifelong, supports, and that some people refer to that as wraparound services, but we also need early intervention. So it's not good enough to say that the child will outgrow this, or it's not good enough to say, well, let's wait until the person is in junior high school. So, and the last take-home message is that it's preventable. So it's very important to get the message out there that no alcohol during pregnancy is the only answer to not having a baby prenatally exposed to alcohol. Okay, here's a question. Is the 049 campaign also intended to be targeted at professionals? Yeah, it'll be a public awareness campaign, and they have posters that will be going up. So it will be out for the general population as well as for physicians. I know that the Vermont Academy of Pediatrics has also been working with the Department of Health, obviously, in this campaign, and then also in beginning to set up trainings or for physicians. Okay, so I wanted to thank you so very much for signing on for the hour here, from Jill Stevens and myself. Thank you very much for your interest in FASD, and we most likely will be back for a second part of this webinar, and I'd like to thank you for joining us on today's webinar. This webinar will be archived on the Vermont Family Network's website, along with many other previous recorded webinars, which are a great resource to everybody. Be sure to visit VFN's website at www.vermontfamilynetwork.org for a complete list of upcoming webinars, workshops, and support groups. Thank you very much and have a great day.